Welcome back, dear viewers. As you know, in today's fast-paced world, artificial intelligence has become a driving force transforming industries from healthcare to security. It now diagnoses diseases, predict strikes, and even assist law enforcement through neural and brain wave analysis technologies. But there is a question frequently asked: how far can AI go in understanding the human mind and nature, and where should we draw the line? To discuss this and more, please join me to welcome our guest for today, Dr. Ammar Obaid, consultant and information cybersecurity specialist and technology in AI and medical sector. Welcome, Doctor, to Good Morning Kuwait.
Good morning, Kuwait.
So let's jump into business and ask the first question. How is artificial intelligence currently transforming the healthcare sector? We know, and we can see and witness in the past few weeks and days, that there is, let's say, a wave of transformations. People are now applying and operating, let's say, complicated surgeries through satellite from Kuwait, Paris, China, and also in other locations. How AI helped us to achieve these successes?
Correct. AI tools nowadays have reached to that the brain of the human being is just like exactly like the hard disk in your computer. The hard disk in your computer, whatever you entered into it, it will be saved, it will not be deleted, it cannot be formatted, even if you format it.
Yes.
So we have reached that the brain of the human being is just like the hard disk. Whatever you have saved in it since you was born till you grow.
Yes.
All the information will be saved and it will not be deleted or formatted.
So it's there. We just need to find ways to level them up into the service and to reuse them again.
That's what we call it, the tools.
Yeah.
The technical tools.
Yes.
How to connect to the brain of the human being and start reading the brain or start sending the questions. The questions which is related to a certain project, certain subject, certain crime, certain patient.
Exactly. So now let's talk about healthcare sector and AI. And many questions have been raised in recent years. How AI can predict, let's say, diseases before even the symptoms show up? Because as you know, especially now post-corona pandemic, COVID-19, we face too many health problems in Kuwait, in the region, globally. So how can we employ AI to protect, let's say, the diseases before even the symptoms show up?
Okay, let me be honest with you. AI tools, you reach to the point of, or to the level of, that can diagnose the patient where he's complaining from, where is the pain is. Directly, it will show the pain of the patient, and it will report it directly after the diagnostic. But to be honest, till now the AI tools did not reach to the point of that the patient, we can tell the patient that you're going to have a problem with so-and-so, or you're going to have a disease somewhere in your body.
So it doesn't predict the future in terms
Nothing in the future, exactly.
So it only treats cases are existing now, the facts.
Now, what's going on now.
Yes, what is on hand. How to treat it, what is the problem, where is the problem, to be more specific.
And where is the problem?
Where is the problem to treat it?
Where is the pain? Where is the virus? Exactly. Where is it right now? But nothing in the future.
Nothing in the future. So that means AI will not take the role of the doctor. Assist the doctors and medical personnel to, let's say, save time, save money, and also save lives.
Life too. AI, we can say, AI tools is going to help the doctors, not to replace the doctors. It will help the doctors fast, accurate.
Yes.
Sometimes the doctor is not accurate, by the way. So accurate and save life and fast, and tell the doctor directly where to go and work on the problem.
So AI will help us in, let's say, healthcare industry to, let's say, direct or set the path of treatment.
Directly.
Also, does the patient need
Sure.
surgery, or he need, let's say, treatment? So it sets the
It's
path.
both. It's for both, yes.
Okay. Let's talk about something more interesting. Now, we know that AI is everywhere now. Let's talk about controlling the brain through AI. We saw it in movies. We see it in, let's say, infection.
Correct.
But now it's coming to be reality. So is AI going to help not only healthcare industry, but also law enforcement?
Yes, let's talk about security.
Security in general.
Yes. See, what I'm talking about right now is reality.
Okay.
The system is available and can be tested and can be used. Let's talk about in the security sector.
Okay.
AI tools, and where we call it the BIC, Brain Image Classifier.
Okay.
We have helped the investigators. We have helped the police, let's say, to get the information, to get the evidence.
Okay.
Even if there is no evidence, even if there is no fingerprints, we can get the evidence from the brain of the suspicious person or from the criminal.
But isn't that will be, let's say, a violation of personal information or personality? It's a violation. It's a violation even if it's with consent, even with approval. But I know there's a suspect, I know we have a case, but how could you, let's say, violate his personal space, violate his brain even? According
to the law, even if this suspicious person, and we know that he is the guy who knows the information that we need, or he's a suspicious, and he was there in that once the crime happened or occurred, then I think they give the green light to the police or the investigators to investigate this person and put him under this system, where to connect the system up to
certain waves and tools.
Yes, directly to his brain. There will be readers on his head and brain, connected to directly to the brain, just like the hard disk, and start sending information or sending questions
or waves even to trigger brain cells.
It is, see, these are questions.
Okay.
Questions, just a text. Where have you been last night at 9 o'clock?
So asking the brain, not the person.
No.
You're not looking for a verbal answer or even, let's say, a body language answer.
Because the person is not going to answer me. He refuses to answer me. That's why I'm going to use this system and get my evidence information from his brain. So I'm going to send him questions, some questions.
Okay.
These questions will be converted. See, will be converted.
Okay.
Into pulses and electronic signals to his brain, and read and get the answer only. Look at this, and get the answer for my questions only. They get the answer from my question and to be converted and to be sent on my screen as a text.
So that is your evidence.
Correct.
Okay. Now, as in healthcare sector, do you think also using the brain image classification system, can we predict crime? What will happen in the future? We saw that in fiction, in science fiction movies, in science fiction series, but in reality, can we predict future crimes?
Again, this system or these tools cannot discover anything in the future.
But why it cannot discover anything in the future, but it can still, let's say, dig in the suspect person?
Can discover something
in
is
the
there
past.
already.
Yeah, but
in the
also
past.
based on the past, we can predict the
Anything
future.
in the past is already recorded and saved, but anything in the future is not.
I know, it's unknown,
Yeah.
but according to data, according to the evidence, we can also predict. Let's say, put some scenarios.
Well,
Can AI help in creating scenarios?
It may can happen or reach to that level,
Yes.
high level really. Let's call it, but it's not there yet.
It's
Seriously,
not, yeah.
at the right now we haven't reached to that level.
Well, that's amazing. Okay, one more question. Do you think in the future, near future,
Okay.
AI would replace certain, let's say, professions? We hear and read certain reports and, let's say, a lot of reports and research say that few professions will disappear from the face of the earth with the emergence of AI.
Again, AI tools is nothing other than smart tools, automation, transferring any information,
Okay.
manual information into a digital. So it's not going to replace any professionals or doctors or engineers, but actually it will help the engineers, doctors, even teachers
Yes.
to do their job fast and
more
accurate
sufficient.
and correct and most efficient. Exactly.
and sufficient. Okay, one more thing. Could you explain how, no, not this question, how accurate and reliable that this technology today? This is my final question for today. How accurate can we rely on AI? I know it's a double-edged weapon. We cannot completely rely on it, but in today's fast pace, as I said in the beginning.
Yes, here I can say yes, we can depend on technology, seriously. Personally, I've been in a hospital one day and I was complaining from a disease and nobody can find it.
Yes.
Nobody can discover it from the doctors. But at the end, even the machine, they've been using the machine to discover what I'm complaining from, and they didn't discover it. Unless a doctor, a Kuwaiti doctor, an experienced Kuwaiti doctor came to my stomach and he did something and he directly
send you to the operation.
sent me to the operations right away.
So let's say here in this case, AI saved your life.
Yes,
but sometimes
absolutely.
AI cannot save life, can complicate things even.
Sure.
Yeah. So thank you very much, Dr. Ammar, for joining us in Good Morning Kuwait and to clarify the information about AI. We are honored to have you and we wish you all the best in your future.
Same here. Thank you very much.
Well, thank you also the viewers for joining us, and we were talking with Dr. Ammar Abu Obaid, consultant and information cybersecurity technology AI in the medical sector, about the use of AI in today's world.
Thanks for being me here. Thank you very much.
Thank you. So let's take a break and then let's see what we have next.
Thank you.